it's not unusual that someone experiences low back pain, and ankylosing spondylitis may not be the first thing that the healthcare provider thinks about. So distinguishing it can be difficult unless you are aware of the symptoms that are specific for inflammatory back pain as opposed to mechanical back pain. Okay, ankylosing spondylitis is an inflammatory disease that predominantly affects your spine. It can go from the neck all the way down to where the pelvis attaches to the bottom of your spine. It's a lot different than mechanical back pain, which is sort of what most people experience. Ankylosing spondylitis can lead to disability, and it's very important that it gets recognized and treated early in the course of the disease. Mechanical back pain often has a reason, a cause. You lifted something incorrectly, you've had an injury, so that's something to think about. But mechanical back pain often kind of feels better when you sit down or lie down at night, and you don't have that prolonged stiffness in the morning or the need to get up at night and move around just because of this deep aching pain and stiffness that you develop often after midnight. Well, I like to tell my patients, if you find yourself super stiff in the morning, you wake up and you just can't get rid of that extra stiffness, it lasts an hour, 2, 3 hours, maybe longer, then it's time to be a little concerned that something else might be going on. Also, if you find yourself waking up at night from back pain, unrelated to moving around, just waking up and having to get out of bed, that's another sign of inflammatory back pain. We see ankylosing spondylitis lasting longer than 2 to 3 months, whereas most back sprains and strains will go away after a month or two. Ankylosing spondylitis tends not to do that. So persistent, prolonged stiffness in the back or spine or neck, low back, or the chest wall even, can be a sign that ankylosing spondylitis is developing. But one thing that is very typical about inflammatory spinal disease is that people feel better when they move. They like to keep moving. They don't like to sit in their car for a long time. They don't like going to movies because after 15, 20, 30 minutes, they just feel very stiff and they have to get up and move around in order to relieve some of the pain they have. The pain can worsen or spread to other areas of the body over time. Because you don't sleep well at night, fatigue is often a very common symptom that we see as well. Untreated ankylosing spondylitis can get worse over time or move to other areas of the body. Your spine can become deformed and you can experience joint and ligament damage. You may also develop associated conditions, inflammation of an eye called anterior uveitis that can cause blurry vision, eye pain, sometimes visual loss, and light sensitivity. So you'll be very sensitive to light, it can hurt your eyes. Some people develop an associated condition in the skin called psoriasis, flaky red skin rash, or inflammatory bowel disease. There are associated symptoms that are kind of, I call them hitchhiker symptoms, not part of the disease, but as a consequence of the disease. These are depression and anxiety and fatigue. You may be at a higher risk for developing cardiovascular diseases. You may develop permanent disabilities that take away from your mobility, independence, and just general quality of life altogether. One of the problems with inflammation or inflammatory arthritis, whether it's in your joints or your spine, is that if it goes untreated, it's irreversible. What happens is there, and if we can intervene sooner rather than later, you will be doing a lot better in the future than you would have otherwise. So it may take a while to get in to see a rheumatologist, but don't give up, or if you still think that something might have been missed, perhaps even if you do see a rheumatologist, don't give up. You need to find a reason for your back pain.